So I'm an OBGYN. I take care of women during labor and delivery. I also take care of all their gynecologic needs. I also have a special interest in LGBTQ plus care, so I take care of a lot of non-binary and trans patients as well. I just try to make everyone feel as at ease as possible. It's really important to me that I create a non-judgmental environment. This is a safe space where patients can really bring any of their concerns to you, and should be able to bring any of their concerns to you in a way where they're going to feel heard and they're not going to feel judged. Some patients you have that connection with right away, and you can delve right into sexual history, obstetrical history, and meet their needs at that time. Some patients, it's really just kind of establishing that connection and sort of going as far into the history as they want you to and as they'll let you. I love labor and delivery. I love making that connection with a mom as she's going through that process of, bringing a child into the world. I actually love pushing with my patients and, just sort of being there and supporting them through that process. But then I also love, when my teenagers come in and they're coming in for their first OB visit and they're really nervous and they've heard that pap smears are uncomfortable, and, taking them and walking them through them and helping them at the end realize, okay, this isn't so bad. I trained in New York City and practiced in New York City for a while before coming back to my hometown of Cleveland. I had a lot of trans and non-binary patients just based on where I was located. And I really developed a special interest because I felt like it was a patient population that wasn't getting their needs met. And while, gender-affirming hormone therapy is not difficult to do, I think it's something that a lot of providers are just not comfortable with and don't have a lot of experience with. And so I began doing more and more of that. I love that OBGYN gives you that opportunity to really see patients in multiple settings and through multiple phases of their life. You do begin seeing whole families, which can be really rewarding and very nice, especially because then you'll see them in labor and their support person will be someone else that you know too. So I've gotten to the point now where I'll go in for some deliveries and I know the whole room. So I spend most of my time with my kids, right? Because that's what we do. So I'm very much a mom, and I love it.